This video will demonstrate how to set up your Invacare oxygen concentrator, either the Perfecto 2V or the Platinum 10. This video is not meant to replace the user manual that you received with your concentrator. Please refer to the manual for information regarding safety and proper usage before using your concentrator. The intended function and use of an oxygen concentrator is to provide supplemental oxygen to patients with respiratory disorders by separating nitrogen from room air. This product is not intended to be life-sustaining. First, select a room in your house where using your oxygen concentrator would be most convenient. If necessary, your concentrator can be rolled from room to room on its casters. The air intake of the unit should be located in a well-ventilated area to avoid airborne pollutants and/or fumes. Next, plug the power cord directly into an electrical outlet. Attach the 50-foot tubing to the outlet port on the front of the concentrator. Now attach the other end of the tubing to the oxygen connector that has been provided. Push and twist. Next, connect the cannula to the other side of the oxygen connector. The cannula has nasal prongs that should point downward into your nose. Wrap the tubing behind your ears and tighten the tubing under your chin. If you have been prescribed the use of a humidifier, remove the cap from the bottle. Fill the humidifier with boiled tap water or distilled water to the level indicated by the manufacturer. Boil tap water for approximately 10 minutes and cool to room temperature prior to use. Insert a flathead screwdriver in the plate groove on the top edge of the filter access door and gently pry the filter access door off. Pull up and remove the humidifier bottle adapter. Attach the humidifier bottle adapter to the humidifier bottle by turning the wing nut on the humidifier bottle counterclockwise until it is securely fastened. When placing the humidifier bottle in the compartment on the concentrator, attach the humidifier bottle adapter tube to the oxygen outlet connector on the concentrator. Attach the patient's nasal cannula supply tube to the humidifier bottle outlet. Now press the power switch to the on position. All the panel lights and the audible alarm will come on for 1 second, confirming that the indicators are functioning properly. When the unit is first turned on, the yellow light will come on, indicating the unit is operating and is in the initial warm-up period. When the green light comes on, the unit is in normal operating mode. Now turn the flow rate knob to the setting prescribed by your physician or therapist. To properly read the flow meter, locate the prescribed flow rate line on the flow meter. Next, turn the flow knob until the ball rises to the line. Now center the ball on the liter per minute line prescribed. It is important that the flow meter be at eye level when setting the flow rate. To maintain your oxygen concentrator, first unplug it. Then use a damp cloth or sponge with a mild detergent such as Dawn dishwashing soap to gently clean the exterior case. Allow the concentrator to air dry or use a dry towel before operating the concentrator. There is one cabinet filter located on the back or the side of the cabinet. Clean the cabinet filter with a vacuum cleaner or wash with mild liquid dish detergent such as Dawn and water. Rinse thoroughly. Allow it to dry and reinstall. If you have any questions about your oxygen concentrator, please call your home care provider.